Good morning, everybody. This is Tammy Epps, and I am the Director of Media Relations and Social Media here at Prisma Health. Thank you for joining us again, to everyone who's joining either in the Zoom with us, our media partners, or those who are joining us via Facebook. So I know that everybody has started shopping for Christmas. A lot of people already have those lists. I know my little niece has a list on the refrigerator already. So we are already looking for toys for our children. But at Prisma Health Children's Hospitals, both the Midlands and the Upstate, we want to make sure that you're choosing safe toys for your children. So today we are partnering with US PIRG, Public Interest Research Group, to remind you about toy safety. We always want to be safe when we purchase those toys. So on the panel today, we have three of our experts. We have Dr. Jeff Holloway, who is one of our pediatricians at Prisma Health Children's Hospital in the Midlands. We have Katie Craig, who's the State Director of North Carolina PIRG. And we have Bridgette Watson, who's a Safe Kids Upstate, injury prevention for the Bradshaw Institute for Community Health, Child Health and Advocacy. Whew, that's a long title. And that is associated with our Prisma Health Children's Hospital in the Upstate. So with that, I'm going to go to Dr. Holloway for some opening comments. Dr. Holloway, give me one sec. Dr. Holloway.
No problem. Thank you. Thanks for having us and everyone for joining. Yes, at our Prisma Health Children's Hospitals here in the Midlands and in the Upstate, our team is always advocating to keep children safe in the community, whether it's helping them to make sure that they get all their proper vaccinations, to alerting the community about new medical guidelines related to children, or alerting parents about toy safety. We're dedicated to protecting our child's and your child's health in these communities. Today, we are fortunate to have the U.S. Public Interest Group's 37th annual Trouble in Toyland report to share with families. As a pediatrician, unfortunately, I've cared for many children who've been injured, sometimes seriously, from toys. We never want something intended to be fun and in this magical time of year to turn tragic. I will start with some general reminders about toy safety, and then our U.S. PIRG representative will tell us a little bit more about what they found on the shelves this year. Just because the toy is for sale doesn't mean it's safe. So obviously it can be defected, it can be recalled in the future. We always have to be mindful of the different ages that we have in the homes. So while buying a toy for an older kid, a younger child in the house may get into those. And so smaller pieces can be very detrimental because of the choking hazard for younger kids. So we often say, if the toy can fit inside a tube of toilet paper, it's too small for kids 3 and under. If you're going to purchase anything that's wheeled, like scooters, bikes, those sort of things, we highly recommend that your child get fitted for a helmet and other safety equipment. Helmet use can decrease the risk of head injury by 88%. Also, we want to be very mindful of toys that are kind of not the typical ones. So antique toys, maybe toys that you find online that may not meet the rigorous standards of safety that we'll see with most toys. Also, if a toy is too loud, this can be harmful to a child's hearing and development. So probably if it's too loud for you, probably shouldn't give it to a child. And remember that new batteries, certain settings on these toys can increase the sound and therefore cause the hearing damage. There are numerous different ways that these toys can be harmful, unfortunately. But now I'd like to introduce Katie Craig, who's the State Director at North Carolina PIRG, to go over some of the specific toys that are on their list.
Yeah, thank you so much for having me today. And as Dr. Holloway said, my name is Katie Craig. I'm the State Director with North Carolina PIRG, and I'm excited to be here with our Southern neighbors today to share the findings of this year's Toy Safety Report. So for our 37th edition of Trouble in Toyland, we are focused on 3 main areas of concern. The first of those being recalled toys that can still be purchased. The second being the role of parents and caregivers in keeping our children safe. And the last being counterfeit toys that continue to infiltrate retailers' shelves and online platforms as well. So this year on recalls, our national network conducted an investigation last month where we tried to buy 16 toys that have been recalled this year, and we were able to still purchase half of them, sometimes in multiples. So in total, we purchased 8 toys that had been recalled this year, and then additionally 3 toys that had been recalled in the last few years. So in total, we received 11 different types of toys and over 30 total toys. And these toys were bought from US-based online sellers, including Facebook Marketplace and eBay, as well as several online toy shops. And they included items ranging from stuffed animals, action figures, musical toys, and more. And the vast majority were new in the box or new with tags. And so coming out of this year's report, we have really 5 key takeaways. So the first is that it's really critical for parents and caregivers to read warning labels and inspect toys, especially if you have children under 3. So as Dr. Holloway already mentioned, one thing that we should definitely be keeping an eye out for is choking hazards, especially for children that are younger than 3. And so we have this sort of tester, and if you don't have one of these tubes, you can definitely use a toilet paper roll or paper towel roll. And typically, if a toy is small enough to fit within the tube, then it does pose a choking hazard to younger children, and is something that parents should definitely keep an eye out for. And additionally, not just looking at the toy itself, but also pieces on the toy that might be able to break off, things like screws or small plastic pieces that could break off with wear and tear over time. Our second takeaway is that we need online sellers to stop selling toys that have been recalled or are counterfeits. And I have today some of the recalled toys that we were able to purchase in October as a part of this study. So the first of those is the Aflac plush duck. This was recalled in June because it contains certain components of it contain levels of toxic phthalates. So that's one of them. Next, we had a string of digidots. I'm not sure if y'all can see those there. These are high-powered magnets that were recalled in March because if a person swallows 2 or more magnets, they can connect in the digestive system and pinch internal tissue together, which can cause very serious issues with intestinal blockage or blood poisoning or other issues as well. The third toy is these activity loop toys by the Manhattan Toy Company. These were recalled in June because these tubes that you see here can detach, and then the smaller plastic pieces on the toy are able to break off and pose a choking hazard for children. The next toy that we were able to purchase is the Army action figure playset by Blue Panda. These ones you can see here, they were recalled in October because they contained excessive levels of toxic phthalates and lead. And then just a couple more here. We also had this Kiddo Hudson glow rattle, which was recalled in March because these rattle legs that you see can break off and pose a choking hazard. And lastly, the Ubi connecting bath toys. These were recalled in 2019 because the toys can break and create a sharp point, which also poses a choking hazard as well as laceration hazard as well. So definitely, a reminder for parents and caregivers to be keeping a close eye out for these recalled toys, especially if you're buying from these secondhand shops. And then a few more tips that we have. Our third tip is that Shoppers should also stay on guard for counterfeit products, which often don't meet US safety standards. So shoppers should check saferproducts.gov for recalled products before they buy things, especially from these online marketplaces. And a good rule of thumb is if an in-demand toy is really difficult to find, and then all of a sudden you see it online or it's much cheaper than it should be, you may need to do some more investigating to figure out whether or not that could be a counterfeit. And additionally, our national network is also calling on Congress to pass the INFORM Act, which is aimed at stopping sales of stolen, counterfeit, or dangerous consumer products, including toys. Fourthly, parents should periodically check toys for wear and tear to make sure pieces can't come off, and also make sure battery compartments are secure. As kids play with toys over time, there's different pieces that might come loose or be more likely to break, and so it's good to just periodically check for those things as well. And then lastly, families need to take care with those little round batteries known as button batteries or coin batteries. We've seen these as a continued hazard as well. And there are some new laws that are making these more secure, but it doesn't necessarily apply to things that you may already have in your home, especially things that might not be your typical toys, but that kids can get a hold of, things like remote controls or key fobs. Really keeping an eye out for those. So in summary, our goal is to draw attention to the dangers in the marketplace so that we can bring about change. And this year, we're really focusing on those 3 key areas of recalls, counterfeits, and injuries from toys that are not inherently dangerous. And we hope that this report can serve as a wake-up call. And we know that it will take all of us, from toy manufacturers, retailers, regulators, lawmakers, and consumer advocates and families, to do what it takes to protect our children. So thank you so much for having me here today to share some of the findings of this year's report.
Good. Thank you so much, Katie. With that, we're going to go to Bridgette Watson, who spends all of her time trying to keep kids safe with the Safe Kids program. Let me get her there. All right, Bridgette. So you heard Dr. Holloway talking, you heard Katie talking. Wanted to give you a chance to add on.
Yeah, thanks. And like Katie said, and like Tammy said, my name is Bridgette Watson. I'm the Safe Kids coordinator with Safe Kids Upstate with the Bradshaw Institute here in the Upstate. So I think everything that Dr. Holloway and Katie said are just really important, and you can't hit home enough the importance of these safety tips, and repetition is key. So even if you tell one family member this last Christmas, it's important to bring it up each year, especially as our kids continue to grow. It really comes down again to making sure that we advocate for child safety standards, and we proactively check these toys to ensure that they are appropriate for the kids that we're buying them from. That could, of course, make some uncomfortable conversations when children are given toys that maybe aren't that appropriate for them, but we must have these conversations to keep our kids safe. And that goes for all ages and development. And also be sure that if you're celebrating Christmas or maybe going to a new home that's unfamiliar, having those conversations with those family members about childproofing and making sure anything that's unsafe is put away and locked away is also really important. But I think that the annual Trouble in Toyland report is an excellent resource for families. Some other resources that families can use, as mentioned, was the Safer Toys, Consumer Product Safety Commission, National Safety Council, Safe Kids Worldwide. Those are all some really great websites and free resources that families can use. But overall, we really just want to make sure that the holidays are fun and safe and enjoyable for everyone.
Good. Thank you so much, Bridgette. I'm going to go back to Dr. Holloway for a second. Dr. Holloway, I know you said earlier that you've seen children that have been unfortunately injured due to toys. And what would you want to say to parents out there today who are watching, and just as a reminder about how important that is to just be vigilant around that?
Yeah, absolutely. I mean, I would, as a parent myself, years ago, after one of these reports, I went home and looked at all my toys, and I had one there on the list. So it's not like these are super uncommon or crazy things because you bought it randomly off the internet. They're available everywhere. And we want to try to avoid these injuries because unfortunately, some of them can be pretty detrimental. Between the swallowing, choking can be fatal, and some of the things like the batteries and the magnet ingestion can cause irreversible damage to the insides that we hope to avoid.
Yeah, so that's really, I guess that's key to everything that both you and Katie and Bridgette have said, that, you know, toys are supposed to be fun. We're trying to make sure that we don't cause some damage for kids that have to live with for the rest of their lives. And I know no parent or grandparent or auntie or all the relatives ever want to do that. So thank you, Dr. Holloway. I'm going to go back to Katie. There's a question about recalled toys. Katie, the question is, what are some of the top reasons for a toy being recalled, and where can parents, just a reminder where parents can find that list?
Yeah, so some of the top reasons that toys will be recalled is choking hazards, that a toy or
Oh, I think we might have a connection with Katie. Is it everybody having that problem? All right, I'm gonna go to oh, Katie, are you there?
Who's back?
Sorry, yes, it looked like I froze for just a second. I'm
Okay.
not sure when I cut out.
So start over then.
Okay.
Start over that question. So the question was, what are some of the top reasons for a toy being recalled, and where can parents find that list?
Yes, so some of the top reasons that toys can be recalled are some of the reasons that I mentioned from the toys we had here today, things like choking hazards or toxic chemicals being found in toys. Additionally, things like items that are flammable or could pose a risk of laceration or strangulation are also common reasons that toys can be recalled. And one of the best places where you can look at to see the toys that we were able to purchase is in our report, which I'll drop the link to in the chat, as well as you can look online at saferproducts.gov for lists of recalled toys there as well.
Good deal. I'm going to go to Bridgette. Bridgette, there was a question or wanted to make a comment in reference to counterfeit car seats. I think you've mentioned that you've seen some counterfeit car seats, and you know what parents should be looking for. I know that's not actually a toy, but it's something we use very importantly with our kids. So I'll let you address that.
Yeah, that's a great point to bring up, because a lot of families are purchasing possibly new car seats for Christmas for their family members. And we've unfortunately seen a pretty big increase in counterfeit car seats being sold, and we've seen them here in South Carolina. So it's just really important for families to make sure that they are doing the same things Katie said around toys, same with car seats. There are certain labels that have to be on car seats that are usually a pretty dead giveaway if those labels are not there, that they could be a counterfeit car seat. But my biggest advice to families would be, if you're in question, reach out to one of your local inspection stations. I know here for us at Prisma, we have inspection stations all throughout the state and all of our locations. So if you're in question, reach out to a child passenger safety technician, and they will definitely be able to help you determine if the car seat is counterfeit or not.
Good deal. All right, so let's see. I think that is all the questions we have for today. I'm going to go back to everybody well, since you're up, Bridgette, I'll let you give some final thoughts, and then I'll go to Katie, and then back to Dr. Holloway for final thoughts.
Yeah, I think we've covered a lot of areas for families today. The only other thing I would say is, if you don't have poison control number or any of those really important emergency numbers on your fridge or really close by, that would be something I would definitely recommend families to have in their home, as easy access to those really important numbers to call. All
right, and then I'll go to Katie.
Yeah, so I think we never want to see these toys that are meant for fun and play to be causing harm to our children. And so we're releasing this report as a way to continue to educate consumers and also bring about change. And, you know, we've come a long way in seeing both recalls and injuries are down, but we still have a ways to go to make sure that every child is safe.
Dr. Holloway.
Yeah, and I think part of the reason that injuries were down is due to the pandemic. We had a lot more supervision and discussions. And so while that's lifting and having some more freedoms, trying not to go backwards, but continue to be vigilant about watching our kids, thinking about all those things, having discussions between family members to buy the appropriate toys so the kids can have the most fun this holiday season.
Thank you. Thank you so much. Thank you to our experts, Dr. Jeff Holloway, Katie Craig, and Bridgette Watson for sharing their thoughts. At Prisma Health Children's Hospital, you know, we're always concerned about our community and our kiddos out there. So y'all all be safe out there. If you have any other questions, please put them in the chat on Facebook and we'll try to get an answer for you. And we're wishing everyone a great holiday season and everyone have a great day. Thank you.